if you're in search of a dental implant solution for your missing teeth or unhealthy teeth, it's important to know that not all options are created equal. Quality control credentials and predictability are really important.
Joining us, Dr. Richard Aguilar of Jacksonville Dental Specialists is here today. We're going to talk about hybrids and becoming an informed consumer when evaluating your options. Doc, how you doing, man?
Doing great. How are you?
Good, good. And so this is, when you're going to do something like hybrids, it's a big undertaking for the patient, and they got to think about a lot of different things. What are the things they should be considering when doing their research?
Yeah, there are three main things that you should look at. You should look at the credentials of the doctors that you're seeing. You know, more and more general dentists are kind of learning to place implants and kind of placing their own, but you should truly look at the credentials. At Jacksonville Dental Specialists, we truly have two specialists treating you. I'm a periodontist. My specialty is on the surgical side, and then my partner, Dr. Naraki, is a prosthodontist, where his expertise is on the restorative side. So anything as complex as hybrids, you want someone with the expertise, and you want someone who's, you know, certified, and we are the only certified hybrids providers in Northeast Florida. What does that mean? You don't have to question the training, the experience level of your doctors. Okay. Another thing to look at is the predictability of the treatment. We use a hybrid process that has been time tested for the past, over 20 years and has kind of adapted to technology. So it's something, the protocols are very, very predictable, expedient, and simplified, so patients get a good outcome. And the last thing you want to look at is the quality standards of the materials that you use and the dental implants. Our labs are here in the United States. Our main lab is in Rochester, New York, our hybrid lab. Everything is FDA approved. We use the highest quality implants. We don't, have a generic implant that we use. We use only the highest quality implants. So these three things are very important whenever you're looking into some complex dental care like hybrid.
Speaking of complex, let's get into some of the technology that you use at hybrid.
Yes, technology is very important. It's something that we take pride in. Some of the things that we do is we have a three-dimensional CT scan that allows us to view the anatomy ahead of time, know exactly where to place the implants. We actually pre-plan the surgery before the case even starts, so we know exactly how thick the bone is, where the nerve is, where the sinus is, and make things very predictable. Another thing that we do is we like to sedate our patients, so it makes it a pleasant experience for the patient. They're pretty much sleeping through the procedure. They get the procedure done, they wake up and they're done. So part of dentistry today is making it a good experience for the patient, and that's one thing that we do.
Yeah, and one of the things, a good experience is not being without teeth throughout the process. And that's one of the things people think, if you're going to replace every tooth in my mouth, this isn't going to happen overnight. Am I going to have weeks or days where I'm going to be without teeth at all?
Right. That's a great question, and what we tell patients, you will never be without teeth, okay? We kind of make the decision with you if is it going to be fixed temporaries or removable temporaries, and a lot of it depends on your case. What we don't believe in is going to the final prosthesis 24 hours. It's just, you can't change biology, you can't change healing, and there's just too many changes that occur whenever you have implant surgery to go to that final prosthesis. But in our cases, we like predictability. We like to say, we don't think about teeth in a day, we think about teeth for a lifetime. So in no time will you be without, temporary teeth.
Well, I like how you were talking about being sedated, because I have a fear of the dentist. So I like that part of it, and I'm sure a lot of people appreciate that. But what about the pain? Is there a painful process after, following? Explain the pain.
That's a great question as well. During the procedure, as we said, you're not going to feel anything. We like to use minimally invasive techniques, meaning we try to minimize incisions, we try to minimize surgeries with bone grafting. We also have a lot of experience. We placed 600-700 implants a year. We do more of these full arch cases than anybody in Northeast Florida. So just from our experience, just from our minimally invasive techniques, the moderate discomfort that you may have is well taken care of with any medications that we prescribe. So patients do surprisingly very, very well for this procedure.
So many questions when you're considering something like this, and obviously, like we say at the end of each one of these, the best way to get all of your questions answered is at that seminar, and your next one is Wednesday, April 18th, right?
Yes, we have a monthly seminar. It is next Wednesday on the 18th. It's at our Jacksonville office. We talk about hybrid, we talk about other treatment modalities that we provide for our patients. We answer your questions, you get to meet the staff, you get to tour the facility, and then afterwards you get a complimentary consultation.
There it is. That's the best way to do it. Appreciate you joining us.
Thanks for having me.
And we want to thank Jacksonville Dental Specialists for being here and bringing us great information. And for more information, you can visit jacksonvillehighbridge.com. You can also call 904-584-3867.